Hello, my name is Trevor Cox, and today I'll be presenting the comparison of oral and intravenous iron supplementation in anemic patients proposal to the International Research Board. For my research proposal, my current research question that I have chosen is what is the effectiveness of oral iron supplementation when compared with intravenous or IV iron supplementation for patients with anemia. The purpose of this study is to explore iron supplementations for patients with iron deficiency anemia and to determine the most effective method of administration. The alternative hypothesis is, as stated, a correlation exists between a type of iron supplementation and correction of anemia. I would first like to provide the introduction to why my research proposal should be considered and why this topic is important. Iron is an essential mineral in the body and plays an important role in the production of hemoglobin and myoglobin. When iron stores are depleted, this leads to a condition called iron deficiency anemia. Symptoms of this include extreme fatigue, weakness, pale skin, and inflammation, among others. Anemia is treated using iron supplementation. The two forms of administration for iron supplementation are oral and intravenous, or IV. Next, I will speak on the background of the research proposal. Iron supplementation is an effective way to treat patients with anemia and increase their iron levels. Iron infusion is a procedure in which iron is delivered to your body intravenously, meaning into a vein through a needle. Currently, this form of iron therapy is designated for patients with iron deficiency anemia who are unable to tolerate or respond to oral iron supplementation. Benefits of this include bypassing the mechanisms that closely regulate iron intake, and by generating reactive oxygen that has the potential to cause cardiac and endothelial damage. Risks include iron dextran, which was previously the main form of intravenous iron supplementation, but has recently been updated, has contributed to 31 deaths due to a high risk of anaphylactic reactions occurring in patients. However, this is not the iron preparation that will be used in this research proposal, and this will be explained later. Oral iron supplementation is taken iron by the mouth in the form of a pill. The benefit is that this is a cheap, safe, and effective option to correct anemia. The risk includes its limited absorption due to the method of administration, gastrointestinal disturbances, and non-adherence to the treatment. Both of these forms can decrease the severity of iron deficiency anemia and reduce symptoms related to this condition. And how do we test for anemia? Well, currently, the gold standard for diagnosing anemia is bone marrow biopsy and iron staining. Although these invasive tests are rarely justified for routine clinical setting because of the price, there are more affordable and simplistic tests that can diagnose anemia. In this research proposal, we will be using the hemoglobin color scale that was created by the World Health Organization, or WHO. And this is a clinical instrument for diagnosing anemia and is a less invasive procedure that would be more advantageous in a clinical setting. For the subject recruitment, we used a G-power calculation to see that it will take 236 participants at an attrition rate of 5%, which means that there would be 225 participants for significance, and these participants will be recruited from the Prisma Health Hospital in Greenville, South Carolina. For the study subject criteria, the inclusion criteria is the ability to provide informed consent. The age eligibility will be 18 years to 80 years. Adults and older adults are welcomed to participate in this study. All sexes are eligible. The patients need to be not currently receiving iron supplementation, and they need to have received a current diagnosis of iron deficiency anemia. Their hemoglobin levels must be less than 13 grams per deciliter for men and less than 12 grams per deciliter for women at the initial screening before being accepted into the study. The exclusion criteria will be a needle phobia in the intravenous iron supplementation group, currently receiving iron supplementation, which would skew the results, making them ineligible, and the inability to provide informed consent or adhering to the inclusion criteria listed. The research methods will now be discussed. This will be a 12-week randomized controlled trial. The iron preparations used will be ferric gluconate, which will be the intravenous iron supplementation group, and ferric citrate, which will be the oral iron supplementation group. The use of experimental groups and control groups will be taken for this study. The experimental groups will be using the iron preparations listed above. The control groups will be using a placebo in the form of a saline solution for the intravenous iron group and a dextrose pill for the oral iron supplementation placebo group. A general health survey will be conducted before participants are accepted into the study. Additionally, if all of that goes smoothly, they will also take a comprehensive metabolic panel, which will test for things such as hemoglobin and other important blood panels. HIPAA compliance will also be taken into account, as this will be performed at a Prisma Health hospital, which they already comply with, but will be reiterated at the start of the study. The use of a cloud-based electronic medical records will be used, as the research team will be diverse, including members throughout the United States. Moving into the data analysis portion, as discussed, a comprehensive metabolic panel will be taken before the start of the trial. So these blood panels will be drawn 3 times over the length of the trial. Once before, once at the midpoint or at the 6-week, and after, which would be at the conclusion of the trial at the 12-week. The purpose of the midpoint, which is not always used in research studies such as this one, is to test that the health of the individual is taken into account, because we do not want to put their health at jeopardy. The use of a two-tailed t-test will be used, as this is the best type of analysis tool to be used in the comparison of 2 different variables, such as intravenous and oral iron supplementation. The Statistical Analysis System, or SAS program, will be used to analyze the research data. And the use of data anonymization will be used so that there will not be a breach of compliance or privacy of the patients in the trial. Moving into the discussion portion of the IRB proposal. First, I would like to discuss the safe administration of both oral and intravenous iron supplementation. For oral, it is straightforward, and we just have to ensure that myself and the research team will have to ensure that the participants are properly swallowing and intaking enough water with the oral supplementation. For the intravenous, it is a little more complex and will require a team of trained professionals to properly insert the needle and administer the intravenous iron solution. Next, we need to determine the tolerable upper intake level, or the UL, especially for the intravenous iron supplementation, as research has suggested that higher intakes can be determined to be advantageous, but also at a higher risk for the patient's health. The risk and benefits to participants include the potential of a nutrient deficiency due to the high absorption of iron and how that affects them biologically. The benefit would be to replenish their iron stores and essentially take them from a hemoglobin level that's below the healthy level into the healthy level, essentially eliminating their iron deficiency anemia condition. Additionally, this will be under the supervision of Prisma Health Hospital employees and clinical staff to ensure the safety of the participants in the study. To conclude this presentation, I would like to bring up the following question. Will intravenous iron supplementation be more effective at the correction of anemia than oral iron supplementation? Iron supplementation is known to aid in vital functions such as GI health, immune system, and regulation of body temperature. It also improves hemoglobin levels and replenishes iron stores in the body. And it may also decrease symptoms related to anemia. And this goes for all types of iron supplementation. Again, the purpose of this study is to determine the most effective method of administration for iron supplementation. I hope that you will consider this in the International Research Board for my proposal. Thank you for watching.